Nebulizer is an electric machine powered by an outlet and plug or batteries. It turns liquid medication into a fine mist that is inhaled into the patient's lungs by a mouthpiece of a face mask. This delivers the medicated mist and helps the patient breathe better. And for the indication, if you have a medical disease that affects your breathing, such as pneumonia, asthma, chronic obstructive pulmonary disorder or COPD, respiratory infection, nebulizer can be used. And here you are seeing the equipment. It is composed of machine, the mouthpiece, the medicine cup, mask, and hose. So now I'll be showing you how it is prepared. First is to wash our hands to reduce microorganisms or prevent transmission of pathogens. And the second step is to place the medication into the nebulizer. Medications that can be put in the nebulizer include inhaled beta agonist and anticholinergics, inhaled glucocorticoids, and inhaled antibiotics. And the third step is to attach the mouthpiece. Secure it to the nebulizer cup. Most nebulizers have mouthpieces instead of face masks, since masks can lead to facial deposits. The fourth one is to connect the tubing. Attach one end of the oxygen tubing to the nebulizer cup. On most types of nebulizers, the tubing will connect on the bottom of the cup. Connect the other end of the tubing to an air compressor used for nebulizers. The first step to use the nebulizer is to turn on the air compressor and use the nebulizer. Put the mouthpiece into your mouth, above the tongue, and keep your lips sealed tightly around. Inhale slowly and deeply in through your mouth so that all the medicine goes into your lungs. Exhale either through your mouth or nose. Second is to continue to inhale the medication. Sit up and keep inhaling the medication until the mist stops. This usually takes about 10 to 15 minutes. Third step is to turn off the nebulizer and clean up. Be sure to unplug it from the outlet and detach the medicine cup and mouthpiece from the tubing. Wash the medicine cup and mouthpiece with warm soapy water and rinse them with water. And the fourth step is to disinfect the nebulizer once a week. To disinfect, always follow the manufacturer's guidelines. And that's it. Thank you. I'll also be discussing about drug administration. First is the ophthalmic medications. These are administered for local treatment. So the medication must be at room temperature or body temperature before the application, and it has to be sterile. Only preparations with preservatives can be repeatedly used. The major problem, though, is that the immediate loss of a dose by natural spillage from the eye. About 80% of a dose will be lost from the eye by overflow. And unused ophthalmic medications should be discarded 30 days after the container is opened. Manufacturer expirations do not apply once a patient has opened the medication. Okay, I'll be discussing about the ophthalmic ointments formulation. It tends to keep the drug in contact with the eye longer than suspension. It is also or most ointments are made of mineral oil and white petroleum and have a melting point close to body temperature. And ointments cause eye blurring and should be applied at night. So this is how ophthalmic medication is administered. Before application, patients should wash hands to prevent contamination of the application site. Tube or dropper should not touch the application site. Medication may become contaminated. And only sterile ophthalmic solutions or suspensions should be used in the eye. Patient's head should be tilted back. After administration, the patient should place a finger in the corner of the eye next to the nose to close the lacrimal gently. It is to prevent loss of medication through tear duct. A major problem of ophthalmic administration is the immediate loss of the dose by natural spillage from the eye. And a patient should also keep eyes closed for 1 or 2 minutes after application. Ophthalmic ointment tubes are typically small, holding approximately 3.5 grams tube. When multiple drops of more than one medication are to be administered, the patient should wait 5 minutes between different medications. The first drop may be washed away. If an ointment and a drop are used together, the drop is used first. Wait 10 minutes before applying the ointment. Let's proceed with the otic medications. It must be at room temperature or body temperature. Heated drops may cause rupturing of the eardrum. Cold drops can cause vertigo and discomfort. And old medication should be removed along with any drainage before applying fresh medication. Alcohol causes pain and burning sensation. Should not be used if the patient has a ruptured tympanic membrane or eardrum. The procedures are as follows. Tilt head to side with ear facing up. It takes 2 to 5 minutes. Cotton swabs placed in the ear after administration of drops will prevent excess medication from dripping out of the ear. Swabs will not reduce drug absorption. Patients under 3 should have lobes pulled down and back, and patients over 3 should have lobes pulled up and back. So that was the drug administration, otic, ophthalmic, and nebulization. I hope you enjoyed, and thank you for watching.